and welcome back to Meet the Leaders. I'm your host, Terrance Micas. My guest is Dr. Randy Pardell, who's the director of the TMS Center of the Hudson Valley, which is Transcranial Magnetic Stimulation. It's a treatment for depression that the FDA has just approved, and it's done without drugs, and it isolates places in the brain that stimulates the brain and helps people, and they've had great success in it. We're talking about that. We're going to talk now about whether the healthcare industry will pay for it and things like that. So fascinating. People that just joined us right now, of course, didn't see the little video we put on. But transcranial magnetic stimulation is not used that much right now. It's just coming into effect, but it was used, the technique was used before, not approved by the FDA, but it was used on other things when people have had, let's say, strokes and things like that.
All right. Well, TMS originally was investigated and started out in 1985 and in England and Europe and Australia and New Zealand. Throughout the globe, people were using the power of the magnet and transcranial magnetic stimulation.
Power of the magnet.
Power of
it's
the
like
magnet.
A commercial, right?
The power of the magnet. And what we started to see was it was used in people who had strokes and trying to define and map certain areas of the brain. For instance, as you saw in the video, we were able to map the motor cortex to locate where we're going to give the stimulation. And you saw the woman's thumb begin to move, and we see that when we do our treatment. So it was originally used to test where in the brain the magnet could be used and effective. But then they were able to show that through repeated transcranial magnetic stimulation, it began to treat mood problems and depression problems.
And how long does the treatment, and I know it's probably not the same for everyone, last?
Well,
excuse me, I want to rephrase that. How long does the effects of the treatment last? Then we'll get into how long it actually takes to do the treatment.
Well, there was a 6-month study after the 4 to 6 weeks acute study, and they found that over 90% of patients remained well at the end of 6 months. Now, they did have what we call rescue TMS. People began to get a little bit depressed. They brought TMS back in a booster kind of way. And we found that over about 90%, even a little bit over 90% of patients remained well.
So does it permanently change what it fixes in the brain, or do people start to say, hey, I like feeling good, and I'm going to stay feeling good? I mean,
sometimes we'll have some patients where it's almost like you prime a pump, as it were, and now it's working well. Other people, you prime the pump, and it's working for a while, and then it falls back. It falls back again. So somewhere around 40% of patients needed to have that booster TMS. 60% of patients didn't.
Is that connected to maybe how things were going in their life? If they had a broken relationship, if they didn't have a job, someone died? Or is it connected to, in other words, if things were going better in their life, did you think those were the people in the test group that were able to just sustain it?
It may be that people who have less stresses that happen in their lives are able to sustain the treatment longer because of the fact that things are going well in their lives. We're all living in a very stressful world right now, and so all of us are dealing with economic or stressful life events, and so that puts a burden on all of us.
So why did Dr. Randy Pardell get involved in this? I mean, you've had a practice for years, doing different things. Why this?
Well, it's 2 reasons. One is I love the science of psychiatry. I love the innovation that happens in psychiatry. So that's really what excited me. But really, the most important part was I learned from my patients. And one of my patients, about 4 years ago, spoke to me. He said, I'm really struggling with my depression. I've read about transcranial magnetic stimulation. What do you know about it? So I started to read about it, and in fact referred him to one of the experts in transcranial magnetic stimulation that were doing the original studies. And he had a consultation with her. He didn't get transcranial magnetic stimulation because they didn't meet the protocol criteria. But when transcranial magnetic stimulation came out, he was the first one to email me and let me know, you got to get this, doc.
All right, so you don't just do that.
I don't do that. I do the full complement of treatment for depression and anxiety and all the major psychiatric illnesses.
So you treat whatever way you need to treat, and that's part of the treatment. But people need to know that this is there and that it's something that could be very effective for people with chronic depression.
Absolutely.
The actual treatment takes how long?
The actual treatment, each and every time, takes about 37 minutes But I tell my patients it'll be about an hour of your time,
How long?
5 days a week for
Okay.
4 to 6 weeks.
Okay. I mean, that's a little bit of a commitment, but boy, the benefits certainly outweigh any commitment that people would have to. They would have.
When we were working with our first patients at the TMS Center of the Hudson Valley, what we're seeing are people who are really suffering from pretty severe depression and have been depressed often for up to 2 years period of time and even longer.
I was going to say, what about the poor? Can they do this? But actually, the middle class is kind of in that category these days. But I'm getting into a political statement there. I mean, money is hard to come by. What does it cost? I mean, what is the? I mean, I know that we're going to get into the insurance, and this is an interesting time to talk about all this stuff because they're having that battle over health care and health insurance and all that. So what is the? I mean, is it expensive?
It is an expensive procedure. What we see is throughout the country, depending upon the area of the country, it can be between $350 to $600 a treatment. So it's pretty expensive treatment. But we're seeing that insurance companies are dealing with it on a case-by-case basis, and it just received what we call a level 1 CPT code. That's the American Medical Association reviews this, and they said this is a bona fide treatment and it deserves a level 1 CPT code. And that's the first step before insurers begin to take it on and pay for it on a general basis.
So you think insurers are going to like to pay for something that may cost, what, $24,000, $25,000?
Well, it's not that much. It's usually $8,000 to $10,000
for a month
for that treatment. Yes, yeah. But what we see is that it's less expensive than electroconvulsive treatment, which is another intensive treatment. That's the treatment where people get, it was called shock therapy, where people go into the hospital, they are under anesthesia.
People don't want that.
But when people are depressed, that's something that they'll go to.
And drugs over a period of time cost a lot of money too. I mean,
and especially when you're using 5 different drugs. At the same time,
expensive.
It gets expensive. And then we also take a look at the cost of depression. In the year 2000, there was a study that indicated that $83 billion a year are lost due to depression. So it's loss of productivity, loss of money from suicide, for instance.
Doctor, and it's just all biological, physiological. It's not. I mean, what about you've heard the old saying, we're soul, we're spirit, we're mind, all those things connected. It seems to me that there might be other factors than just being predisposed to that. I mean, address that to me, because I know a lot of people are struggling with that. All of a sudden we're just predisposed to depression. It seems to me that a lot of factors cause people to be depressed, at least the ones I deal with and run into.
So let's take a look at depression. These are really important questions and issues. I tell my patients, depression is not a moral weakness. It's a physiological vulnerability and medical illness. Now, what does that mean? We have 30,000 genes in our genome. Many of those genes give us a predisposition to not handling stress well. And if you have tremendous amounts of pressures and stresses on your life, any one of us can develop a depression. So it's a compilation between stresses in one's life and a predisposition that leads to depression.
So if someone's has a predisposition to being depressed based on all the gene makeup, and there's a lot of pressure that comes on them, and they have some traumatic experience that takes place to really kind of thrust it into a stronger position in their lives, that they can never, that someone with a stronger personality may not buckle the same way.
I mean, I call it kind of like there are some Navy SEALs out there that you can hit them with a ton of bricks and stress in their life, and they won't become depressed. But I believe most of us who aren't Navy SEALs, most of us will have some level of stress or pressure that will overwhelm our ability to cope, and it can lead to a depression.
So you think that within how much time will the insurance companies say, you know what, I think this is something we're going to
I'm suspecting probably by next year.
Really? What does a person do to contact you? We're going to put information up a little later in the show so that you can write it down. Actually, let me talk to you. We could put it up now. We'll let people write it down, and then we'll go back to it. So if people are interested in saying, this is something that's really touching me, it's really kind of saying maybe this is the hope that I was looking for in this area of depression.